Well, the incidence of diabetes is rising in the United States. Many people are either unaware that they have the disease or they don't manage it properly. So joining us to discuss diabetes is Dr. Ruth Horowitz, Chief of the Division of Endocrinology and Metabolism at GBMC Healthcare. All right, Dr. Horowitz, so tell our viewers, what is diabetes and how does someone know if they're at risk?
So diabetes is a condition where your body does not dispose of glucose properly. That glucose then builds up in your bloodstream and can cause damage to various organs. We see damage to small vessels that are seen in the eye, the kidney, the nerves, and then as the disease progresses, damage to the larger vessels that can lead to your increased risk of stroke and heart attack. The people who are at risk are people who have a family history of diabetes, women who had a history of gestational diabetes,
Okay.
people who are overweight.
Okay, so we hear a lot about pre-diabetes, right? Is there any way to slow or reverse the onset of pre-diabetes or ways to control or prevent diabetes itself?
Absolutely. So the hallmark of the first line of therapy is diet and exercise.
Okay.
So eating a balanced diet, limiting carbohydrate, increasing protein and complex carbohydrates in the form of vegetables and other healthy carbohydrates. Exercise. Exercise is key. 30 minutes of aerobic exercise 5 days a week is at a minimum of what people can do, and modest weight loss. Even a 5% weight loss can reverse hyperglycemia.
Okay, wow, just that little bit. Okay, so aside from type 1 and type 2 diabetes, and of course gestational, are there any other kinds of diabetes that are just as important to recognize?
The other form of what we tend to see is steroid-induced. People who did not have previous diabetes, who are being put on steroids, can have a significant spike in their glucose. Also, post-surgical patients who've had abdominal surgery that involves the pancreas can develop diabetes at that point.
Okay, and so among all the health symptoms and difficulties of COVID-19, another question that's coming out now is, does the virus, could it be triggering an increased case of diabetes?
Absolutely. We are seeing significant hyperglycemia related to the infection itself.
Wow.
And then the treatment for COVID patients in the hospital is often high doses of steroids. And that can provoke significant and severe hyperglycemia in patients that didn't have problems before, people who were controlled with their diabetes prior to developing the infection.
Okay, and so do different kinds of diabetes respond differently to COVID-19? And does getting the vaccine or a flu shot affect people's blood sugar levels?
So I'm going to take the second part first. So getting the vaccine, if you have an acute reaction to the vaccine, I have seen some patients whose glucoses temporarily spike up a bit, just like any other infection or inflammation can cause your blood sugars to go up. The other question was,
do different types of diabetes respond differently to COVID-19?
Not necessarily. I mean, you can see hyperglycemia in both type 1 and type 2 diabetics. We have seen an increased incidence of patients with type 2 diabetes who develop COVID developing diabetic ketoacidosis, which is usually seen predominantly in type 1 diabetics who are very ill. But we're seeing this also in type 2 diabetics, which is very unusual. And then type 1 diabetics can also develop DKA in response to the severe hyperglycemia. So there is a slight difference, and we are seeing worsening of diabetes control acutely in both groups.
Okay, wow, such great information. The information where our viewers can find you right there available on our screen. Thank you so much for your time. I appreciate it.
Thank you very much.